This is Paul An, and the presentation today is entitled Controlling COVID-19 in South Korea. And before my presentation, let me briefly introduce myself to you, in addition to what Dr. Kim has just done. Okay, I'm Paul, and I was born and raised in South Korea, and my Korean name is Anderson, and I studied history and public policy in Korea. And then I moved to Australia and studied accounting. And I became an accounting PhD, and I became a certified public accountant in Australia. And then I moved to the UK, and I became a lecturer in accounting. So maybe you guys are a bit confused. Why an accounting lecturer is giving a guest lecture to you guys? So today I'm going to begin with what accounting is. So I want to break the normal, typical assumption of you guys first. Okay. When you first think about accounting, maybe you will think of numbers, counting. Yeah, accounting has counting. Maybe you think of math. I hate math. And then you may think of accounting as boring. Yes, accounting is boring, but accounting can be interesting, because in my discipline, accounting is not just numbers. Accounting is a synonym of accountability, and accountability assumes a human relationship, because when we say someone account for something, it is the same as someone is held accountable for something. Usually it has this form. Someone, say A, is held accountable to someone else, say B, for an action or decision, say C. Okay, this is a typical accounting relationship. And accountability by dictionary is defined as requiring or expecting someone, B, to justify actions or decisions, C. Okay, and in my discipline, accountability is often defined as demanding and giving reasons for a conduct. So B demands A to give reason for a conduct. Okay, in response, A gives B reasons for his or her conduct. Okay, so accounting and accountability involves recording, reporting, explaining, responsibility, answerability, stewardship, and etc. So in Korean language, we don't have this word accountability. So it's too sad. So accountability, it originated from the West. It is from Judeo-Christian religion. So in Korea, we don't have that root. So we don't have this concept of accountability. We have responsibility, but we don't have accountability. So in my discipline, accountability is a synonym of governance, control, and management. So now you can see how come I give a presentation of controlling COVID-19 in South Korea, because controlling involves accountability relationship. Okay. So as I said in the previous slide, accounting and accountability is originally a religious practice. Okay, so we humans are accountable to God originally. So that is the starting point of accounting and accountability. And now it has ethical implication as well. So you guys are children of your parents. So children are accountable to your parents. So you guys are accountable to your parents, to your mom and dad. Okay, in married relationship, husbands and wives are accountable to their spouses. So in ancient history, servants were held accountable to their masters. In modern society, employees are accountable to their employers. Usually accountability flows in the opposite direction of cash flow. So cash flows from employees to employees, and accountability is flowing from employees to employer. So employees receive cash from employer, so they are held accountable to their employers. And it can be beyond financial relationship. So politicians are accountable to citizens in modern democratic society. And my question now is this. What about citizens? So citizens are accountable to whom for what in this pandemic era? So we've been suffering from COVID-19 for a year. So I think we normal citizens are held accountable to somebody for something. So this is my research question. So I'll give you a wee presentation about my paper. So this paper is entitled Pushing the Limits of Accountability, Big Data Analytics Containing and Controlling COVID-19 in South Korea. So if you received my slides, you can click this link and you can access the paper. Okay, let me start my presentation. So my presentation has like a bit boring part and more interesting part. So I'll start with my boring part. So when researchers write down a paper, so we don't just give a case. We try to link our findings with the literature. So in my literature review section, I reviewed the literature, accounting literature, about accountability and big data. Nowadays, big data is in fashion. So I investigated the big data's implication in accountability relationship. So I had reviewed two bodies of big data and accountability literature. And the first one is at an organizational level. So what I found is this. Big data analytics, now they use GPS and CCTV technologies. And these technologies produce a lot of data, which is big. So it is big data. And this big data is analyzed. And because of this, employees' activities became more transparent. So as a result, their accountability for their conduct is enhanced. For example, previously, so many years back, when GPS was not used, so employees just used the company vehicles for their personal use after hours. So during the daytime, they used vehicles for the business, but after the hour, they used vehicles to go to dinner or go for a movie, to date with boyfriend and girlfriend, and etc. But that's not possible anymore because nowadays company vehicles have GPS installed there. So the route of the vehicle is monitored on real-time basis. So big data analytics now enable surveillance monitoring. So their actions and their conducts are being monitored. So I claim this as pushing the limit of accountability. So nowadays, employees are held accountable for their conduct to a greater extent than before. Okay, this is the first body of literature that looked at the accountability relationship and big data at an organizational level. The same thing can be seen from a societal level. Previously, even before the arrival of big data, let's imagine a phenomenon. So a colored young man hanging out in a poor area, these young guys are more likely to be stopped and questioned by patrolling police because of their higher likelihood of crime. Okay. But now we are living a big data era. Now, middle-aged men like me, middle-aged men with obesity and high blood pressure, now we are charged by big data analytics higher premium, higher health insurance premium, and we have to get regular medical checkups. Okay. In the UK, yeah, we have National Health Service, so health insurance is like a public good, but in many other countries, they have to buy a private medical insurance. In the case, big data analytics charge higher insurance premium. So from this, we know segments of population can be now held accountable for possible future risks their body might bear because of big data analytics enabled surveillance regime. So this also push the limit of accountability. So every normal man and women are held accountable to a greater extent than before. Okay, this is what the accounting literature on accountability and big data shows to us. Okay, and another boring thing researchers do when they write down a paper is engaging a social theory. So I used very complicated theory devised by Gilles Deleuze and Félix Guattari. They are French philosophers and social scientists. So I'll just briefly mention their key concepts. So they argue that in modernity, the organizational structure is like a tree. It is very central. You can see tree here, very central and very hierarchical. Okay, they call it arborescent. Okay, so for example, I live in Glasgow, and I pay council tax to Glasgow City Council. Okay, Glasgow City Council is accountable to the Holyrood government, Scottish government in Edinburgh, because Scottish government give money to Glasgow City Council. Okay, and the Glasgow City Council is accountable to the Scottish government. Likewise, Scottish government is accountable to the Westminster government in London, the central government, because the money comes from London to Edinburgh. Okay? So it is hierarchical and central. So it is like tree. And in contrast, in postmodern era, which we are living in, Deleuze and Guattari argue that organizations are linked and connected, and they are controlled in a rhizomatic manner. So rhizome is these roots. You can see the roots here, and these roots are entangled with each other. There is no center, there is no hierarchy, but somehow they are linked. Okay, so modern organizations are linked, not modern, postmodern organizations are linked like this, like rhizome. So rhizome means these entangled roots. Okay. So another big words, territorialization, deterritorialization, and reterritorialization. These big concepts are used by Deleuze and Guattari, but they are very complicated to explain. But just think about how modern day news or contemporary news is produced and then disseminated. Previously, we read newspapers many decades back. So we bought newspapers, and news was generated by news agency. Newspaper, Associated Press, and etc. BBC or Daily Mail, and etc. Press and broadcasters produce news, and we just consume them. But nowadays, people don't watch BBC as much as before, and they do not read newspapers as much as before. Nowadays, news is deterritorialized from mainstream media, and now reterritorialized in social media. So I watch news using my Facebook. People watch and read news through Twitter rather than visiting the website of the Daily Mail or BBC. So this is a simple elaboration of territorialization, deterritorialization, and reterritorialization. And finally, they argue it is by desire, not by power, that postmodern social practice is shaped. So in pre-postmodern, in modern era, power is the keyword. So we can see how social practice worked through the lens of power. So in a company, there is power relationship between employers and employees, managers and workers. And in school, there's power relationship between teachers and students, and etc. But now, relationships are defined by desire. This is the key argument of Deleuze and Guattari, rather than power. Okay, so upon the pandemic, COVID-19 pandemic, now citizens desire for health, safety, and survival. So we want to survive. We don't want to die. So we desire for health and safety and survival. And now many governments desire to control the pandemic. And because if they succeed in controlling the pandemic, they can enhance the approval rate. And finally, they can enhance the legitimacy of their own government. So let me start more interesting part. So I'm going to use these theoretical concepts to make sense of my findings. So the Korean government tried to control the pandemic, focusing on 3 T's. First T is testing, fast testing. So they tried to test as quickly as possible. Okay? And the second T is tracing, meticulous tracing. So South Korean government tried to trace the trajectories of those who have tested positive and those who contacted them. And final T is treating, okay, appropriate treating. So they treated those who tested positive. But today I want to focus on meticulous tracing, track and tracing system. The track and trace system in South Korea has 2 components, right? And both are enabled by big data analytics. The first component is COVID-19 smart management system. So it is called 코로나19 역학조사 지원 system. I'll just call it the system, okay, later. And the second component of the track and tracing system is self-quarantine safety protection app. Okay, it is 자가격리 안전보호 app. I'll just call it the app. Okay, let's begin with the system. So I found that the system was created in a rhizomatic method. So do you remember the concept of rhizome? So there is no hierarchy, there is no center. So when the COVID-19 was first reported in January in South Korea, people panicked. So many government departments had meetings to handle this pandemic. So the key players are Korean Center for Disease Control and Prevention, KCDC, 질병관리본부. And this agency is within the Ministry of Health and Welfare, 보건복지부. Okay, they are the key actors, but there are other actors that do not seem to be related with infectious disease. They are the Ministry of Land, Infrastructure and Transportation, 국토교통부, and Ministry of Science and Information and Communication Technology, 과학기술정보통신부. These government departments are not directly associated with the infectious disease, but somehow they gathered together and they agreed to develop the system. Okay, so they used a smart city data hub. It is a kind of big data analytics technology. And this technology has been already developed by the collaboration of 33 private sector corporations and 8 public sector organizations. And these entities participate in an initiative of MOLIT, 국토교통부, the Ministry of Land, Infrastructure and Transportation. So they try to produce urban big data for their own use, but that technology was used to create the system. It was rhizomatic. There was no hierarchy. There was no center. They are in panic. It was an emergency situation, so they just gathered together, and there was available technology, so they made up this system. Okay. And this system territorialized many databases. For example, they used location data collected from mobile devices. There are 3 telecommunication service providers like SK Telecom. So these public telecommunication service providers provided location data of their customers. And the second database is personal identification information. So every South Korean citizen has their own personal identification number. So everyone is given their own number, and so everyone can be identified by the number. And also, medical and prescription records of hospitals are available. So that bit was territorialized by the system. And the immigration records for foreigners can come into South Korea, and the records of their in and out are available for the system. And there are 22 financial service providers like banks. So many people, Korean people, seldom use cash. They mostly use economic transactions. So all these transaction data was available. And transit pass records for public transportation was available as well. So when they move by using a train, subway, or buses, their movement can be tracked by the transit pass records. And finally, CCTV footages from the police was available. All these are territorialized by the system. Okay, so because of availability of these data sets, so KCDC was able to reconstruct the trajectory of each person in 10 minutes. Okay. And then this type of locational information was diffused. Okay. Firstly, it was released to the public on the Ministry of Health and Welfare's website, 보건복지부's website. So if you click here, you can see the updated data. Data is updated every day. And then the local councils are territorialized. Okay? And then local councils send text message, okay, to their residents. So one text message is like this. So 15th foreigner in Jongno-gu is a borough in Seoul, staying at Somerset Palace Hotel in Seoul has tested positive. For more information, such as their path of movement, please visit our websites. So every council sends this type of text message. So if one person moves one borough to another borough, they receive different types of text messages from the local councils. So many people say this is annoying. So they constantly receive this type of text messages from local councils. And normal citizens, independent government, voluntarily made websites. So if you click this, you can see the websites. These websites show the hotspots of coronavirus transmission and they made it voluntarily. So it is not public sector one. It was not official one. They are just every man and woman. They just made up because of desire for self and safety and survival rather than power. No one told them to make these websites. No one told them make an app. So they made mobile application like COVID, Corona 100 meter. So because of desire for health and safety rather than power, they made this type of websites and mobile apps to diffuse the information, locational information of the infected people. Okay, another component of the surveillance regime is self-quarantine safety protection app. 자가격리 안전보호 app. And I'll just call it app. And this app was developed and used by the Ministry of Interior and Safety. So the 행정안전부, this ministry is not directly related to infectious disease, but they made, because it was emergency, okay, they made this app. They have two types of apps, one for public servants and the other for normal users. So normal users' use of the app was monitored by public servants. So those who closely contacted the COVID-19 confirmed body had to self-quarantine for 14 days. And during this period, they have to report every day to KCDC about their locations and health conditions. So when they install the app on their smartphones, the app users must make sure that they give consent to the collection of their location information. Okay? And then they should be available for calls because public servants call them at any time at random hours. And they have to give consent to the collection and use of their personal information, such as their name, date of birth, sex, nationality, mobile phone numbers, and self-quarantine address. Okay, let me show you the English instruction for the installation of the app. Okay, so the app users should allow the public servants to call them, and they have to allow the public servant to access to the user's location. Okay. Also, they have to give consent to the collection and use of personal and location information, like this. And then they have to enter their personal information into the system, into the app. Okay. So they give personal information like their name, date of birth, sex, nationality, mobile phone number, and etc. And they have to give the quarantine address as well. So the public servants are assigned to this app. So the public servants in their local councils, to which their quarantine address belongs to, these public servants call the app users randomly once or twice a day to make sure that they use the app. Okay? Otherwise, they just put their mobile phone at home and go for lunch or dinner somewhere else. And when the phone stay put for a long period of time, then an alert message was sent to the public servant and the phone beeps at the time. And if the app users leave the selected quarantine area, both the app users and public servants be notified of this movement so that the public servant will encourage the self-quarantine breaker to return to the self-quarantine area. Otherwise, a police will be contacted and police will enforce the self-quarantine. So it is very serious. And they have to keep their mobile phone with them. And finally, the app users must report at least twice a day regarding their COVID-19 symptoms, like their body temperature. They have to check whether the body temperature is 37.5 degrees Celsius or higher. Cough, sore throat, and respiratory difficulties or breathlessness. Okay. In this way, they are held accountable for their location and health condition. So you can see this. The alarm goes off for this purpose. So they have to report their health condition, in particular the body temperature, like this. So my key argument was this. So nowadays, because of pandemic, the limit of accountability was being pushed. So those who self-quarantine were held accountable to the app for their locations and health conditions to mitigate possible future risks of COVID-19 infection and transmission that their bodies might bear. Okay, this is the key argument of my paper. So they are held accountable to a greater extent than before. So, but there was like side effect or ill effect of the use of this app and the system. It is related to privacy and use and misuse of personal information. So according to the literature on privacy, privacy is a social construct. So different societies have different extent of privacy. So in the UK, we don't ask people about their age. How old are you? We seldom ask this question. We seldom ask, are you married? Do you have boyfriend or do you have girlfriend? We don't ask these personal information because the privacy is taken for granted in the British society. But in Korea, people often ask about the age because depending on the age, we have to choose our tone of communication. So we have to choose whether to use honorific form or casual form of suffix when we have conversation. So for Korean people, the boundary of privacy is different. Okay. So upon the pandemic, the Koreans' desire for health and safety at the expense of privacy and personal information. So the system and the app held people accountable for a possible future risk of infection and transmission of COVID-19, and this practice became a vital social practice, and it was regarded as an exercise of care in relation to self and others. So, but the boundary of privacy was not acceptable in the eyes of foreigners. So publicly disclosed personal information was too much. So family name is disclosed, age, residential suburb, not address, but suburb, and travel route of confirmed patients were released, but these types of information was sufficient to identify the person. So when we get to know someone tested positive, so some people use this information to identify the person, and they often succeeded. And then they blame those who tested positive. So this accountability practice turned into blame game. So this was an ill effect of the system and the app. So because of this, the Contagious Disease Prevention and Control Act was revised in September last year. So this law is 감염병의 예방 및 관리에 관한 법률. This act was revised last year. Now, information deemed less relevant to an epidemic like COVID-19, such as family name, sex, and age, should be kept confidential. And the collected personal information should be destroyed when there is no more need for the information. So now you can see the boundary of privacy and personal information use is socially constructed. It can change. So that's it for my presentation. So do you have any questions or comments?